Hello everybody, my name is René Najera. I am the Director of Public Health and the History of Vaccines Project here at the College of Physicians of Philadelphia. Thank you for joining us today. I'd like to welcome Dr. Elise Mitchell. Dr. Mitchell is an American Council of Learned Societies Fellow, a Presidential Postdoctoral Research Fellow in the Department of History at Princeton University, and an incoming Assistant Professor of African American History at Swarthmore College. Today we're going to talk about some of the research that Dr. Mitchell has done on the practice of smallpox inoculation. So before we had vaccines, the common practice was to inoculate people with smallpox to give them a milder course of smallpox, hopefully, and then they would become immune to smallpox after that. And so it was done by people who were trained on identifying the right strain of smallpox, getting the right dose, and giving it to the people in the right way so that they would become immune from smallpox later on. And so we know that this practice started sometime in Asia, 1,000 years or so ago, but the history has a lot of gaps on how it made itself west. The common theory or the common thing that we all get taught in public health schools is that it arrived to Europe via the Middle East through some letters from some people who traveled there from England, and that it arrived to the Americas through the knowledge that those letters brought with them. But there is a different and deeper story to be told, and that's why I'm here with Dr. Mitchell. Thank you for joining me, Dr. Mitchell.
Oh, I'm happy to be here. Thanks.
So tell me, how did you become interested in this subject?
So initially, I was interested in the history of representations of the Black body and racial ideologies in text and print media descriptions of enslaved people's bodies. And I became more and more intrigued about how do these different racial and gender ideologies come to bear on enslaved people's actual lives in the period that these ideologies were being formed, and thinking about what were the consequences of these ideologies for the material bodies of enslaved people and for their material conditions. And as I started to dig deeper into the question of enslaved people's embodied experiences, I found out so much about disease and so much about morbidity. One of the diseases that enslaved people encountered the most was smallpox. And as I did more research on enslaved Africans and smallpox, I learned about people like Onesimus. I learned about other West Africans who were already familiar with the disease before they arrived in the Americas, and realized that there's a really rich history to be told about both slavery and smallpox, as well as enslaved Africans' distinct histories with smallpox.
So what were the major findings from this research you did?
Yeah, so in my research for my dissertation and now for my book project and digital history project, I've uncovered over 600 smallpox outbreaks that affected enslaved Africans in the Atlantic world between roughly 1500 and 1800. Most of my research focused on the Caribbean region, inclusive of the British, Spanish, French, and some Portuguese territories in that region, as well as outbreaks that affected enslaved Africans along the coast of West Africa and during their transatlantic voyages. Most of the outbreaks I found affected enslaved Africans while they were in some form of the slave trade, whether that was waiting on the African coast, during their oceanic voyages, or shortly after they were sold in the Americas. Another interesting finding from my research has been just the depth and breadth of enslaved Africans' histories with smallpox inoculation and various other healing techniques for smallpox. I've uncovered a lot of cases of enslaved Africans and a lot of descriptions of West Africans performing smallpox inoculations, which sheds light on the broader history. A lot of times when we talk about West African inoculation, we only talk about Onesimus. And my research reveals that there were many more people who were aware of the practice as well.
Yeah, and just for reference for our viewers, vaccination didn't come fully into its own until the 1800s. So before that, variolation was the only way to avoid smallpox. So all these stories you were talking about, what story did you find the most compelling among everything that you researched?
Yeah, so one of the most compelling histories comes from a text by Charles Artaud, who was a French medical practitioner in Saint-Domingue, or present-day Haiti. And he sat down with a woman who described being inoculated as a child. We don't know the race of this woman, but she described being inoculated as a child alongside a bunch of other enslaved African children by an enslaved African man. And this is one of the earliest descriptions we have of an enslaved African actually performing smallpox inoculation in the Americas. The other descriptions, like Onesimus's and ones from New York, all describe West Africans' awareness of the practice and how it was used in West Africa. But this is one of the first that actually describes the practice sort of being transmitted to the Americas by an enslaved African person.
And when was this?
This was sometime in the early 18th century, so like the 1740s.
1740s. Okay. So, when we go into public health school, we learn about the stories of Jenner, Pasteur, Salk, the major Western, European background researchers on vaccines. But we don't hear about these other stories, right? We don't hear about non-Western societies or societies outside of Europe and North America who were very advanced in their knowledge of disease and vaccination. Why do you think that we don't hear about them as much as we probably should?
Yeah. Unfortunately, that is a question that has much more to do with our fraught present than our past. The persistence of anti-Black racism and Islamophobia and anti-Arab sentiments in the US creates a context in which it's very difficult to pursue research agendas that sort of move outside of a Western frame or move outside of grand narratives that really center Europeans and Euro-Americans. It also makes it difficult to bring those histories into the classroom. So part of the work that myself and other researchers are trying to do is make these histories more public and insist that these histories be just as central to grand narratives of Western medicine and Western public health as any other history of Salk or Jenner or anyone else. Because, without them, we really lose our appreciation for the broader history of medicine and public health and the broader history of humanity.
Yeah, me personally, when I think of a place of medical knowledge, a city, I think of places like Paris, Geneva, London, places in Italy. Are there places like that in Africa that also collect scientific and medical knowledge together and are repositories of that knowledge?
Yeah, so there are a variety of places throughout Africa that have been repositories of that knowledge throughout history. One of the more well-known places is Timbuktu. It was a center of knowledge production in West Africa for much of the early modern period and into the modern period even. But there are also other cities that at different points in time were major centers of knowledge production, especially medical knowledge production in West Africa. Gao, Kano, Bamako, Djenné are some of those cities. In Northern Africa, we have Fez and Marrakesh. In East Africa, Aksum. So all of these places are crucial to understanding this history. And there's a historian, Michael Gomez, who's written a book called African Dominion that talks about the African antiquity and early modern history and tries to sort of reinsert some of these cities into our understanding of global history and of the global history of knowledge production. There's also another scholar, Rudolf Ware, who's written a book called The Walking Quran that talks about Islamic scholars and Islamic knowledge production in West Africa. But unfortunately, again, because of contemporary, quite frankly, bigotry, these histories don't always break through the noise of the other histories that we're more used to hearing about.
Yeah, certainly. And one of the things that we want to promote here at the college is knowledge and understanding of medicine, and it certainly would help and would go a long way for us to understand those stories and those histories coming out of different places in the world other than what we call the West.
Absolutely.
So, Dr. Mitchell, where can we find your research? Where can we learn more about your work?
Yeah, so you can learn more about my work. I have a website, elisemitchell.com. I'm also on various social media platforms as either by Elise AM or by Dream PhD.
All right, we'll link to that in the episode notes. So thank you so much, Dr. Mitchell. I really appreciate this chat. If you're watching us on YouTube, don't forget to like and subscribe. Don't forget to visit us here at the College of Physicians of Philadelphia, downtown Philadelphia, home of the Modern Museum, and we have a lot of good history to share with you here. So thank you for joining us. Thank you, Dr. Mitchell, again. Until next time, this has been another Public Health Chat. Thank you.